Okay, hi, this is Paul Slakis, Good News Broadcast, speaking to Dr. Fazzini. Hi, Dr. Fazzini, how are you?
I'm fine today. How are you?
I'm good. I'm good because one of the things I'm good about is that I don't have a restless syndrome.
Leg syndrome. Restless leg syndrome is a very common and misdiagnosed and underdiagnosed disorder. Okay, it affects about 10 to 15 million people in the United States, but most people have it and don't even know that they do have it. And the reason for that is that when a patient goes into a doctor and complains of numbness or tingling in their legs, the doctors usually think of conditions such as pinched nerves or back pain or circulation problems. They don't ask the second question as to whether the numbness and tingling and burning goes away when the patient moves, and is it worse when the patient's at rest or at night. And then the other reason that it's misdiagnosed is that lots of patients have difficulty sleeping. I'm sure you do occasionally, or I know I do. And one of the reasons that people have difficulty sleeping when they have restless leg syndrome is that they have to keep moving around in order to get rid of these uncomfortable feelings in their legs. So I always call restless leg syndrome the underdiagnosed disease that's just one question away from the doctor making the correct diagnosis. Patient comes in with tingling and numbness and burning in their legs. All the doctor has to do is ask, does it get better when you move around? Is it worse at night? And if a person comes in with trouble sleeping, all the doctor has to do is say, is it because you're having trouble with your uncomfortable feelings in your legs and you have to keep moving around for this uncomfortable feeling to go away? And the reason it's really important to make the diagnosis is because there are all these people that are suffering with this condition, and there are really good treatments that are available. When people have the condition and they don't know they have it, they don't sleep well at night, and they're fatigued the next day, they get depressed, they can't concentrate, and this leads to a great deal of disability. But when people do know that they have it, they can start the therapies, and then they can get a good relief.
And what kind of a doctor would, as a general practitioner, would be someone who you'd ask this question to?
Right. Well, I'm a movement disorder
specialist.
Yes, I'm a movement disorder specialist, which is a person that specializes in Parkinson's disease and other movement disorders like restless leg syndrome. But any doctor can make the diagnosis of restless leg syndrome. And typically it's the primary care doctors that are the first ones that are going to be hearing these complaints, and they're really the first people that are available to making the diagnosis. They're the people that many times will miss the diagnosis because the patients don't even know that this condition exists.
How does someone get this? Where does it come from?
Okay.
Do we know?
There's two types of restless leg syndrome. There's primary and secondary. Secondary restless leg syndrome is from iron deficiencies. People can get it when they have kidney disease. Women can get it when they're pregnant. People can have B12 deficiencies or diabetes. So there's lots of different reasons why people can have tingling in their legs, and even the full-blown restless leg syndrome when they have these other conditions. When they have another cause for the restless leg syndrome, then we call it secondary. But primary restless leg syndrome, many times we don't really know what causes it. It could be genetic, but many times it's sporadic, and there's no known cause of the restless leg syndrome. So anyone can get it.
Okay, so what would a doctor prescribe for each one of those two things?
Right. There's two types of medicines that are used that are indicated by the FDA for the treatment of primary moderate to severe restless leg syndrome. And those two types of medicines are medicines that increase the transmission of dopamine in the brain, and we call those dopamine agonists because they directly stimulate the dopamine receptors. So there's that class of drugs. And then there's another class of drugs called Horizont, which is a medication that works on changing the way the calcium flows in and out of all the brain cells and helps to modulate the neurotransmission of all the neurochemicals in the brain.
Does this disease, is it related to, say, let's use Parkinson as an example? Is it related?
It's related to Parkinson's only in the fact that the same medicines that are used to treat Parkinson's disease can also be used to treat restless leg syndrome. But the important thing that distinguishes restless leg syndrome from Parkinson's disease is that Parkinson's is a degenerative disease that gets worse the longer you have it, and is characterized by a loss of balance and sometimes cognitive impairments, whereas restless leg syndrome is not something that gets worse. Once you identify it and treat it, it typically it stays good and stays under control and doesn't get worse. The only problem with restless leg syndrome is that if you use short-acting medications, a condition called augmentation can develop, where the restless leg symptoms can come back sooner and with a vengeance the next day. So, for example, if you're placed on a dopamine-stimulating medicine that's short-acting, it may help the restless leg syndrome for 3, 6, 9 months, but then the symptoms can start coming back earlier in the day. So if you use a dopamine-stimulating medicine, you want to use a long-acting medicine. But if you can avoid the dopamine medicines entirely and use a medicine like Horizon, then you don't have that problem with augmentation that can develop.
And that medicine does what?
Okay, that's the medicine that works on the calcium influx into the neurons and works on the whole brain. What Xenoport did was they took gabapentin, which is a medicine that's been around for a long time, and they married it to another molecule that allows the gabapentin to be absorbed throughout the intestinal tract. When people take normal gabapentin, the absorption is limited to only the very proximal part of the small intestine, and it's saturable, which means that only a little amount of the medicine can get in. So even if you're taking a high dose of gabapentin, only maybe 20 or 30% of it will actually get absorbed. But by marrying the gabapentin molecule with a molecule that you can think of as almost like a food carbohydrate type molecule, the gabapentin is able to be absorbed throughout the small and large intestine, and you're able to get smooth levels of the medication in the body for a period of 24 hours. And that's where Xenoport has this new technology where they're able to make gabapentin and marry it to this other molecules that are able to make this compound called Horizon.
Aha. So the good news in the Patient Odyssey survey, any specifics you want to share besides what you have?
Well, there's lots of things about the Patient Odyssey survey. There's about 73% of patients report that they experience symptoms every day, and only 6% of people believe that their restless leg syndrome symptoms were completely controlled by their current medicine. 68% of the patients strongly agree that there's a need for greater physician knowledge and understanding of restless leg syndrome, and 42% of patients agree that their healthcare provider does not understand their disease. A full 93% of patients agree that they wished more effective treatments were available to treat restless leg syndrome. And this is where Horizon is really important, because Horizon is a new medication that's available to patients with restless leg syndrome, and it's able to be given to people, and they're able to get much better control than with the other medicines that have been available in the past. One of the problems with the dopamine-stimulating medicines is that they can lead to impulse control disorders, which are like obsessive-compulsive disorders. Patients that are on dopamine agonists can many times develop gambling obsessions or obsessions with sex or with spending money or with eating, and these are big side effects from those medicines. In addition, patients that take dopamine-stimulating medicines can sometimes get vivid dreams or even psychosis, and they can also get sleep attacks during the day. The main side effect with Horizon is that about 10% of people, 10 to 15% of people can have some drowsiness and dizziness, but the majority of those side effects go away after a few weeks of taking the medication. So Horizon's a much easier medicine to prescribe. It's only one dose that's given, and the medication has very well-known side effects that usually go away within a certain period of time. They don't have strange, weird side effects with all these obsessions and sleep attacks and the other things that happen with dopamine agonists. Mm-hmm. So it's an easier medicine to give.
Last question. What's good news for you, doctor?
The good news for me is that my patients that have restless leg syndrome are able to get some good treatment. They're able to get 1 pill a day of Horizon, 600 milligrams, and they're able to get a really good control of the restless leg syndrome, much better than they've ever had before. So I'm really happy that this medicine is out, and I'm really happy that the word is out to the public that this condition exists. And if patients do find themselves with this condition or do think they have this condition, they should tell their local doctors, their general practitioners, They can see Parkinson's and movement disorder specialists like myself who have a great deal of experience with treating this condition. I'm an associate professor of neurology at New York University, and I have offices in Brooklyn and Manhattan and Lawrence and Old Westbury. And patients can get to see me by calling 212-983-1370, and we can make an appointment and squeeze them into the schedule at their convenience. So the good news is that there's a great treatment out there, and we're available to treat them 24/7.